My name is Robert Carlson with Brave Defender Training Group. I want to take a couple minutes of your time to discuss the different phases of care that are within the Civilian Tactical Emergency Casualty Care Program, or TECC for short. Now, TECC is based off of the military's Tactical Combat Casualty Care Program, or TCCC. And it's very important that as a civilian law enforcement officer, you understand which phase of care you are in at any given moment in time during a tactical scenario. Because our goal is to be able to provide the right medicine at the right time to the right individuals. And failure to identify which phase of care you are in can put you or your patient at an increased level of risk or danger. You have to remember, as law enforcement, this is always going to be a tactical scenario. So we can never completely forget about being able to provide our own security and create a safe environment for us to work. Now, the determining factor to help you determine which phase of care you are in is largely going to be centered around or based upon the threat. And a threat can be whatever is posing a risk to either yourself or your patients. Most of the time we look at this as a tactical problem where this is an individual with a gun, possibly involved in a gunfight with us. However, it can be environmental as well if we are dealing with a fire or a car accident. It's just any sort of threat to our own safety or the safety of our patients. So we break TECC up into three distinct phases. Our first phase of care is what we call direct threat care phase, followed by our second phase, which is indirect threat care. And then our third and final phase is going to be our evacuation care phase. And we're going to take a quick look at each one of these phases individually to determine what defines being in that phase and what the appropriate medical intervention is for that phase of care. So our first phase of care is what we call direct threat care. Sometimes this is referred to as being in the hot zone. What defines direct threat care and sets it apart from all of the other phases is the hostile threat, or whatever threat caused these injuries, is still present and still active. So that is our primary concern at this immediate moment in time. Because of that, this is largely going to encompass the actions that are at the initial point of injury, or what we call the X. And because there is still a threat present, usually a tactical threat, the actions are going to largely be centered around self-aid, treating your own injuries to allow the other members of your team to be able to continue handling the tactical problem or whatever the threat that is. So because of that, our absolute number one priority within direct threat care is going to be mitigating the threat. Whatever the threat is, we must reduce and deal with that threat before we start trying to tackle any other issues. The only medical intervention that we're going to be accomplishing during the direct threat care phase is we're going to control life-threatening bleeding to the extremities, such as the arms and legs, through the use of a tourniquet. Any medical interventions or treatment above and beyond that is simply going to be too time-consuming and too hands-on intensive, and is going to place us at increased risk. Now, once we've successfully mitigated that threat, and we have gotten off of that X and away from the initial point of injury, that now allows us to move into our second phase of care, which is indirect threat care, sometimes referred to as the warm zone in some training circles. Now, what defines the indirect threat care phase over the direct threat care is the threat has been reduced. Now, we say reduced, not eliminated, because there's always a possibility of additional threats or secondary threats appearing, so we can never forget about our own security and being able to protect ourselves while we are doing medical treatments. Because we've now moved off the initial point of injury and are now in a position of some sort of cover, or at least at a better location, we are now able to start shifting our focus to more of a buddy aid, where we are providing treatment on an individual because that threat is no longer as active as it was during the direct threat care phase. The medical interventions that we are going to be doing during the indirect threat care portion, we're going to be following an algorithm called MARCH. MARCH is simply going to give us a framework of being able to provide treatments to injuries prioritized based upon what is going to kill the patient the fastest. So the MARCH algorithm stands for major or massive external bleeding or external hemorrhaging, airway, ensuring that the patient has an open airway and is able to breathe, Respirations or respiratory system, where we tackle any penetrating trauma or sucking chest wounds to the chest area. Circulation, which is where we're going to deal with any non-life-threatening bleeding that the patient may have. And then lastly, H, which is going to be for head injuries and hypothermia, trying to keep the patient warm in order to help stabilize them. We're going to follow that checklist in order to be able to provide treatment and keep this patient alive for the longest amount of time possible. Now, our final phase of care is going to be evacuation care. Now, for law enforcement, this is primarily going to be focused on expediting our handoff to a higher level of care, such as EMS. We want to make that process as efficient and as rapid as possible. We can do that by triaging our patients to make sure that the appropriate patients are going out at the right time based upon their severity. Now, this would also be a point where a fire or EMS is not available. Law enforcement may have to consider doing a casualty evacuation or a CASEVAC, sometimes referred to as atypical transport, where we have to transport the patient in the back of our own vehicle to get them to that higher level of care faster. Now, the medical interventions that we're going to be doing during this evacuation care are primarily going to be those focused around stabilizing any treatments that we've already done to ensure that we are not causing additional injuries during our transport. So now that we understand our 3 phases of care, it's critical that you remember and are able to identify which phase of care you are in at any given moment. This is going to allow you to continue to solve any tactical problems while making sure that you are able to provide the appropriate medical aid to any injuries that you have. This is going to allow you to be able to continue and accomplish whatever your mission at hand is while balancing that against your own safety and the safety of your patient. I appreciate your time, and we look forward to doing more training with you. Thank you.